So, wow. I mean, for 5 children to be born negative when perhaps she was positive, unless there was a strong intervention and she didn't breastfeed them and she didn't have...
She did.
Okay.
She blocked to diagnose her because it doesn't make sense.
So that, to me, that the probability of that is very, very low. I mean, now, you know, in the 90s, when they didn't have such a strong programme, the risk was sort of 30 in 100. So that if somebody had one child, then 60% of the time, the child may not be positive. But for 5 children, that sort of defeats all the statistics, I would say. So perhaps it wasn't a correct diagnosis.
Yes.
Or else she was infected after her children. That's the only other thing. Wow. No more questions as hard as that. Thank you, Ramel. So, okay, any other questions? So, I mean, if people are interested... Oh, yeah. Yeah?
You know, what I want to ask is, you know, the way research has been conducted concerning these diseases like AIDS or like HIV or cancer, because you are in the field, so you know more. Is there any hope, or are they still, have they resolved that this particular HIV have no cure, or are they still expecting to find out by research that there will be a cure, really, not just but just a cure, you know, the way you, is there something like that? Yeah.
They're doing work on it, so yeah, they're doing some work on a vaccination. Yeah, and if they can make a vaccination work, then they'll be able to make a cure. Okay. The research with the vaccination, the success rate was only about 35% for the most recent, but that's an improvement because the first one, they stopped it almost straight away because there was no evidence of that it was going to work. So they'll creep towards it, I think. And the only difficulty might be that the HIV as a virus is very clever and it mutates. So it changes, and it's a question of how much it changes and whether it changes significantly enough that if there was a vaccination, that it would change enough that the vaccination wouldn't work. Yeah. So, but they're continuing to work on it because it's important. But really, I mean, if we think about the drugs and the medication for HIV, you know, 15 and 20 years ago, or 15 years ago, there was probably one type of medication, AZT. Perhaps you've heard of that one. And it was very toxic, had a lot of side effects. Whereas now, there are lots of different medications, and people used to have to take, you know, 20 tablets a day or more, and they could make them quite sick. And now there are some people who take 1 tablet a day. Sometimes people take 3 or 4 tablets a day, but it's much better, and the quality of life for people is much better. And it is now a chronic illness. If somebody is diagnosed with HIV in their 30s, it's predicted that they will live into their 70s. Okay, so it's not a death sentence. So that's why it's worth being diagnosed, because if you can live for another 35 or 37, or you know, once you know, well, it's like living with diabetes or something like that, isn't it? Actually.
Christina, what about the psychological effects? Because years back, I used to volunteer in a hospital back in Africa, and there was this lady. She came for an exam. You know, back in the days in Africa, even if they diagnose you with HIV, they will not tell you. They will just hide it. You know, like to to protect people from the psychological damage. And when she came and she was like, they started like accusing the hospital because she was all the time down with an infection. So because she started like making false accusation that the hospital was not efficient, they had to tell her. But when she came, she was quite healthy. They had to tell her and that she had HIV. And 2 weeks later, I saw that lady. She was all dehydrated, and she was not the same woman because she came in a crisis, and 4 weeks later she was gone. So, you know about the psychological damage. It is good to know about the disease itself, but as friends, as a community, as a family, how can you support that person psychologically? And is there any service that supports people? Because I think what kills us more as the disease is the psychological damage itself.
Absolutely. Yeah, definitely. And that's why we're here.
And you know, like what she's saying,
Yeah.
you know, here is different from Africa because the death sentence mentality is still in the mind of people.
Yeah, exactly.
And it means that once you take, that's it. So when you give the news like that, the person is going already.
Yeah.
You see, but here there have been improvement. People can have, just as you said, 30 years and you still expect to live up to 70 years. So.
Yeah,
well, I think the bottom line is it's all about education.
Yes.
It's all about educating ourselves and even our families and our friends and back home wherever we come from. That look, it's not a death sentence. It's all about awareness. And if people don't raise their awareness, it's going to be difficult. It's the same issue as a sickle cell. So many years ago, when you look back now, where there was a very high infant mortality rate in Africa, and people just pinned it down to witchcraft and this and that. It was sickle cell.
Yeah.
People, they were just sickle cell babies and nobody knew because they were not aware of the condition. Yeah. And the babies died, and you had families that they had 2, 3, 4, 5 children that passed away, and they didn't realize it was sickle cell. So it's all about awareness. Yeah. If you're not aware of it, even here, people still hide. People don't want to talk about it. And, so it's just the awareness and letting us also realizing that look, things have improved and people live longer.
So yeah, that's really it, Mo. It's about education and about knowing, isn't it? And being able to talk about HIV like this, not like this, okay? Because if we have to talk about it like this, we'll never move on, and we'll never, help people who are infected and need to be tested. So we have a support service here, and we have, as I say, we have HIV positive people who can be role models for people. We have mentors to help with that psychological impact that HIV can have. And the testing service that we have, some of our testers are positive. Some of the if we've had 4 new diagnoses in the testing, and straight away we've been able to have a positive person come into the room, and because when somebody sees their result and it shows that it's positive, then they go, oh no, this is that's my death or something. And if we have a positive person come in straight away to say, it's not, look at me, I'm working, I'm strong, I take my medication, we have that, we can have somebody straight away to support the person through their new diagnosis. And that's really very effective actually, because it just helps somebody through that process. And then as a community, we need to talk about it openly. That's why we do it today. That's why it's great that Jenny's invited us to this today, so that we can talk about HIV to you as a group and say, it's something we should all know about, it's something we should be tested for, and we should be proud to say, I know my status. And I don't have to tell you what it is, but I should know myself. Yeah, and we should be proud of that. Yeah.
But like about the prevention as well, I think is the way they talk about HIV up to now, even when the government educate the population or the mass. It's still a little bit like that, because up to now I'm turning into my 30. I'm still a little bit confused on how to contract it. People do usually bring the sexual way of getting HIV or the blood-to-blood content, but sometimes we hear here and there that you can contract it, like now you just told by breastfeeding. That we didn't know, but I heard that you can contract it as well with the saliva. So what is the you know, so it's all the thing that make not only the carrier scared, but the person who knows him, and that's why maybe we just treat them as if you were aliens, because you don't know what are the exact means where you can catch the disease.
So I'll just a very quick lesson on HIV then. The only body fluids that we might come into contact with that HIV is in is breast milk, semen, that's sperm in français, and vaginal fluid, so the woman's fluid as well, and blood. Yeah. So they're the only. So not saliva, not vomit. So if somebody's sick, there's no HIV in there unless there's blood. So blood is the strongest for HIV, but then it's sexual fluids and breast milk, and that's it. Okay, unless you're a surgeon, in which case you might come into other, other fluids. But that's it. So you can share a cup with somebody, you can give them a hug, you could kiss somebody with HIV with no barrier, no worry. It's those are the only body fluids it's in.
Yes, but it